Boxer dogs and respiratory problems, understanding common issues. Boxer dogs are beloved companions known for their playful and energetic nature. However, like any other breed, they can be prone to certain health issues, including respiratory problems. This video aims to shed light on the common respiratory problems that can affect boxer dogs and provide a deeper understanding of their causes, symptoms, and treatment options. One of the respiratory problems that boxer dogs may face is brachycephalic airway syndrome. This condition is characterized by narrowed airways, which can lead to breathing difficulties. Boxers with brachycephalic airway syndrome may exhibit symptoms such as snorting, wheezing, and excessive panting. The causes of this syndrome can vary, but it is often associated with the breed's unique facial structure, including a shortened muzzle and flattened face. Allergies are another common respiratory issue that can affect boxer dogs. Just like humans, boxers can develop allergies to various environmental factors. These allergies can manifest as respiratory problems, causing symptoms such as sneezing, coughing, and difficulty breathing. Pollen allergies, in particular, are prevalent among boxers and can be identified by observing their reactions during certain seasons or in specific environments. Indoor allergens, such as dust mites and mold, can also trigger respiratory issues in boxer dogs. These allergens can be found in carpets, bedding, and other areas of the home. Food allergies are yet another potential cause of respiratory problems in boxers. Certain ingredients in their diet can lead to allergic reactions, resulting in respiratory symptoms. Identifying the specific allergenic ingredients and making appropriate dietary adjustments can help manage these allergies effectively. Respiratory infections are yet another concern for boxer dogs. These infections can be caused by viruses or bacteria and can result in symptoms like coughing, nasal discharge, and difficulty breathing. It is essential to promptly diagnose and treat these infections to prevent further complications and ensure the well-being of the dog. Preventing respiratory problems in boxer dogs involves various strategies. Maintaining a healthy weight through regular exercise and appropriate diet is crucial. Excess weight can put additional strain on the respiratory system, making it more susceptible to problems. Additionally, creating a respiratory-friendly environment by minimizing exposure to irritants such as smoke, chemicals, and extreme temperatures can greatly contribute to the overall respiratory health of boxer dogs. Regular veterinary checkups are essential for early detection and management of respiratory issues. By staying proactive and addressing any potential problems promptly, boxer owners can ensure the well-being and comfort of their furry friends. With proper care and attention, boxer dogs can lead happy and healthy lives, free from respiratory problems. Brachycephalic airway syndrome. Brachycephalic airway syndrome is a common respiratory problem in boxer dogs, characterized by narrowed airways and breathing difficulties. This condition is often seen in dogs with short, flattened faces, such as boxers. The shortened muzzle and compressed airways can lead to various respiratory issues. Causes. The primary cause of brachycephalic airway syndrome is the structural abnormalities in the dog's skull and airways. The shortened skull and elongated soft palate can obstruct the airway, making it difficult for the dog to breathe properly. Other contributing factors include narrowed nostrils, an elongated soft palate, and a collapsed larynx. Symptoms. Boxer dogs with brachycephalic airway syndrome may exhibit symptoms such as noisy breathing, snoring, wheezing, and snorting. They may also experience exercise intolerance, frequent panting, and difficulty breathing, especially during physical activities or in hot weather. Treatment options. The treatment for brachycephalic airway syndrome in boxer dogs depends on the severity of the condition and the specific anatomical abnormalities present. In mild cases, lifestyle modifications and management strategies may be sufficient to alleviate the symptoms. These may include weight management. Maintaining a healthy weight can help reduce the strain on the airways and improve breathing. Avoiding strenuous exercise, limiting intense physical activities can prevent excessive panting and respiratory distress. Environmental modifications. providing a cool and well-ventilated living environment can help alleviate breathing difficulties. In more severe cases, surgical intervention may be necessary to correct the anatomical abnormalities and improve the dog's quality of life. Surgical procedures such as rhinoplasty, soft palate resection, and laryngeal surgery can help widen the airways and improve airflow. It is important to consult with a veterinarian who specializes in brachycephalic airway syndrome to determine the most appropriate treatment plan for your boxer dog. Allergies in boxer dogs. Boxer dogs, like many other breeds, can be prone to allergies that can result in respiratory issues. Allergies occur when the immune system overreacts to certain substances, known as allergens, causing a range of symptoms. In boxers, these allergies can affect the respiratory system, leading to coughing, sneezing, wheezing, and difficulty breathing. There are several types of allergies that can affect boxer dogs. One common type is pollen allergies, also known as hay fever. Pollen from trees, grasses, and weeds can trigger an allergic reaction in sensitive boxers, resulting in respiratory symptoms. Another type of allergy is caused by indoor allergens such as dust mites and mold. These allergens can be found in carpets, bedding, and other household items, and can exacerbate respiratory issues in boxers. Food allergies are another potential trigger for respiratory problems in boxer dogs. Certain ingredients in their diet, such as beef, chicken, wheat, or soy, can cause an allergic reaction, leading to respiratory symptoms. Identifying and managing food allergies may involve a process of elimination, where specific ingredients are removed from the dog's diet to pinpoint the allergenic source. When it comes to managing allergies in boxer dogs, there are several strategies that can be employed. One approach is to minimize exposure to allergens. This can involve keeping the dog indoors during high pollen seasons, regularly cleaning the living environment to reduce indoor allergens, and providing a hypoallergenic diet that eliminates potential allergenic ingredients. In some cases, medications may be necessary to alleviate the symptoms of allergies in boxer dogs. Antihistamines can help reduce the body's allergic response, while corticosteroids may be prescribed to reduce inflammation in the respiratory system. It's important to consult with a veterinarian to determine the most appropriate treatment plan for each individual dog. Overall, understanding and managing allergies in boxer dogs is essential for maintaining their respiratory health. By identifying the specific allergens that trigger a reaction, implementing preventive measures, and seeking appropriate treatment, owners can help their boxers live a comfortable and symptom-free life. Pollen allergies. Pollen allergies are a common respiratory problem in boxer dogs, causing symptoms such as sneezing, coughing, and wheezing. When boxers are exposed to pollen, their immune system overreacts, triggering an allergic response. This can lead to discomfort and respiratory distress for our furry friends. To identify pollen allergies in boxers, it is important to observe their behavior and physical symptoms. If you notice your boxer frequently sneezing, coughing, or experiencing difficulty breathing during certain seasons or when in specific environments, pollen allergies may be the culprit. It is advisable to consult with a veterinarian who can conduct tests to confirm the presence of pollen allergies. Alleviating the effects of pollen allergies in boxers involves several strategies. One effective approach is to minimize your boxer's exposure to pollen. During high pollen seasons, it is recommended to limit outdoor activities, especially during peak pollen times. Keeping your boxer indoors during these periods can provide relief from the allergens present in the air. Regular grooming can also help alleviate pollen allergies. Wiping your boxer's paws and coat after outdoor activities can remove pollen petioles that may have accumulated. Additionally, bathing your boxer regularly with a hypoallergenic shampoo can further reduce the presence of allergens on their skin and fur. In severe cases, your veterinarian may recommend allergy medications or immunotherapy to manage pollen allergies in boxers. These treatments can help alleviate symptoms and improve your boxer's quality of life. It is essential to follow your veterinarian's guidance and administer any prescribed medications as directed. By identifying and taking steps to alleviate the effects of pollen allergies, you can help your boxer breathe easier and enjoy a more comfortable life. Remember, if you suspect your boxer has pollen allergies, consult with a veterinarian for proper diagnosis and guidance on managing this common respiratory problem. Indoor allergens. Indoor allergens, such as dust mites and mold, can trigger respiratory problems in boxer dogs. These microscopic irritants can cause sneezing, coughing, wheezing, and difficulty breathing in our furry friends. To ensure the well-being of your boxer and minimize their exposure to indoor allergens, here are some effective strategies. Clean and vacuum regularly. Dust mites thrive in carpets, upholstery, and bedding. Regularly vacuuming and washing these areas can help reduce the presence of these allergens in your home. Use allergen-proof covers. Invest in allergen-proof covers for your boxer's bedding and pillows. These covers create a barrier against dust mites and prevent them from triggering respiratory issues. Control humidity levels. Mold thrives in damp environments. Use dehumidifiers or air conditioners to maintain optimal humidity levels in your home, reducing the growth of mold spores. Keep your home well ventilated. Proper ventilation helps reduce the concentration of indoor allergens. Open windows regularly to allow fresh air to circulate, and use exhaust fans in areas prone to moisture, such as bathrooms and kitchens. Regularly clean your boxer's living areas. Clean your boxer's bedding, toys, and other frequently used items to prevent the accumulation of allergens. Wash these items with hypoallergenic detergents and avoid using strong cleaning chemicals that may irritate their respiratory system. By implementing these measures, you can create a more respiratory-friendly environment for your boxer and alleviate the associated symptoms caused by indoor allergens. Remember, prevention is key when it comes to respiratory problems, and taking proactive steps to minimize exposure is essential for your furry friend's well-being. Food allergies. Food allergies can also lead to respiratory issues in boxer dogs. This subheading delves into the signs of food allergies, common allergenic ingredients, and dietary adjustments that can help manage these allergies. Food allergies are a significant concern for boxer dogs as they can contribute to respiratory problems. When a boxer dog has a food allergy, their immune system reacts negatively to certain ingredients in their diet, leading to respiratory symptoms. These symptoms can include coughing, wheezing, difficulty breathing, and even asthma-like attacks. Identifying food allergies in boxer dogs can be challenging, as the symptoms may overlap with other respiratory issues. However, some common signs to watch out for include excessive itching, skin rashes, gastrointestinal upset, and, of course, respiratory distress. If you suspect that your boxer dog has a food allergy, it is crucial to consult with a veterinarian for proper diagnosis and treatment. Several ingredients are known to be common allergens for boxer dogs. These include beef, chicken, dairy products, wheat, soy, and corn. Eliminating these ingredients from your dog's diet can help manage their food allergies and alleviate respiratory symptoms. It is essential to carefully read the labels of commercial dog foods and choose those that are specifically formulated for dogs with food allergies. In some cases, a veterinarian may recommend a hypoallergenic or limited ingredient diet for your boxer dog. These diets typically consist of novel protein sources, such as venison or duck, and limited carbohydrate sources to minimize the risk of triggering an allergic reaction. Additionally, dietary supplements such as omega-3 fatty acids can help support your dog's respiratory health and reduce inflammation. Managing food allergies in boxer dogs requires a combination of dietary adjustments and close monitoring of their symptoms. It is important to work closely with your veterinarian to develop a suitable diet plan and ensure your dog's overall well-being. By identifying and addressing food allergies, you can help your boxer dog breathe easier and enjoy a healthier, happier life. Respiratory infections. Boxer dogs are susceptible to respiratory infections, which can cause symptoms like coughing, nasal discharge, and difficulty breathing. These infections can be caused by various pathogens, including viruses, bacteria, and fungi. It's important for boxer owners to be aware of the common types of respiratory infections that can affect their furry friends and understand the available treatment options. One common respiratory infection in boxers is kennel cough, also known as infectious tracheobronchitis. This highly contagious infection is often spread in places where dogs congregate, such as boarding kennels or dog parks. Kennel cough is characterized by a persistent, hacking cough and may be accompanied by nasal discharge. Treatment for kennel cough typically involves rest, cough suppressants, and sometimes antibiotics if a bacterial infection is present. Another respiratory infection that boxers may encounter is pneumonia. Pneumonia can be caused by various pathogens, including bacteria, viruses, and fungi. It is characterized by symptoms such as coughing, difficulty breathing, fever, and lethargy. Treatment for pneumonia usually involves antibiotics, supportive care, and sometimes hospitalization for more severe cases. Additionally, boxers can also develop respiratory infections caused by fungal pathogens such as Aspergillus or blastomyces. These infections can be challenging to diagnose and treat, often requiring specialized testing and antifungal medications. Symptoms of fungal respiratory infections may include coughing, nasal discharge, difficulty breathing, and weight loss. If your boxer is showing signs of a respiratory infection, it is important to consult with a veterinarian for an accurate diagnosis and appropriate treatment. The veterinarian may perform diagnostic tests, such as blood work, X-rays, or respiratory swabs, to identify the specific pathogen causing the infection. Treatment options will vary depending on the type and severity of the infection, but may include medications, supportive care, and in some cases, hospitalization. In conclusion, respiratory infections can pose a risk to boxer dogs, causing symptoms that can range from mild to severe. Being aware of the common types of respiratory infections in boxers and understanding the available treatment options is essential for ensuring the health and well-being of these beloved pets. Preventing respiratory problems. Preventing respiratory problems in boxer dogs is essential for their overall health and well-being. By following a few simple tips and strategies, you can help ensure that your furry friend maintains a healthy respiratory system. Here are some key measures to consider. Maintaining a healthy weight. Obesity can put extra strain on a boxer dog's respiratory system, making it harder for them to breathe. It is important to provide a balanced diet and regular exercise to help your boxer maintain a healthy weight. Avoiding exposure to irritants. Certain environmental factors can trigger respiratory problems in boxer dogs. It is crucial to minimize their exposure to irritants such as smoke, chemicals, and extreme temperatures. Keep your boxer away from areas with heavy smoke or strong chemical odors. Regular veterinary checkups. Regular visits to the veterinarian are essential for monitoring your boxer's respiratory health. A veterinarian can detect any early signs of respiratory issues and provide appropriate treatment or preventive measures. By incorporating these tips into your boxer's daily routine, you can greatly reduce the risk of respiratory problems and help them lead a healthy and active life. Exercise and weight management. Regular exercise and weight management are key factors in preventing respiratory problems in boxer dogs. By maintaining a healthy weight and implementing appropriate exercise routines, owners can significantly improve their pet's respiratory health. Boxer dogs are known for their high energy levels and active nature. They require regular physical activity to keep their muscles strong and their body functioning optimally. Engaging in activities such as daily walks, playtime, and interactive games not only helps to burn off excess energy but also promotes cardiovascular health. A strong cardiovascular system is essential for efficient oxygen exchange and respiratory function. In addition to exercise, weight management is crucial for preventing respiratory problems in boxers. Obesity can put strain on their respiratory system, leading to breathing difficulties and decreased lung capacity. Maintaining a healthy weight through a balanced diet and portion control is essential. Owners should consult with their veterinarian to determine the appropriate caloric intake for their boxer and choose a high-quality dog food that meets their nutritional needs. It is important to note that while exercise is beneficial, it should be tailored to the individual dog's age, fitness level, and any pre-existing respiratory conditions. Overexertion or intense exercise can exacerbate respiratory issues in boxers, so it is important to strike a balance. Consulting with a veterinarian or a professional dog trainer can help determine the appropriate exercise routine for each boxer. In conclusion, regular exercise and weight management are vital for preventing respiratory problems in boxer dogs. By maintaining a healthy weight and engaging in appropriate exercise routines, owners can promote optimal respiratory health and enhance their pet's overall well-being. Environmental considerations. Creating a respiratory-friendly environment for boxer dogs is essential to ensure their overall health and well-being. By minimizing their exposure to irritants such as smoke, chemicals, and extreme temperatures, we can help optimize their respiratory health. Here are some key considerations to keep in mind. Avoid smoke. Smoke, whether from cigarettes, fireplaces, or other sources, can be extremely harmful to a boxer dog's respiratory system. Secondhand smoke can cause irritation and inflammation in their airways, leading to breathing difficulties. It is important to keep your home smoke-free and avoid exposing your boxer to environments with heavy smoke. Minimize chemical exposure. Certain household chemicals, cleaning products, and air fresheners can release harmful fumes that can irritate a boxer dog's respiratory system. Opt for natural, pet-friendly alternatives or ensure proper ventilation when using such products. Additionally, be cautious of any potential chemical hazards in your dog's environment and keep them out of reach. Maintain optimal temperature. Extreme temperatures, both hot and cold, can put stress on a boxer dog's respiratory system. Avoid exposing them to excessively hot or cold environments and provide them with a comfortable living space that is well insulated and properly ventilated. This will help prevent respiratory distress caused by temperature extremes. By taking these environmental considerations into account, you can significantly reduce the risk of respiratory problems in your boxer dog. Remember, their well-being depends on a clean and safe living environment that promotes optimal respiratory health. Brachycephalic airway syndrome is a common respiratory problem in boxer dogs. It is characterized by narrowed airways, which can lead to breathing difficulties. This condition is often seen in dogs with short snouts and flat faces, such as boxers. The shortened muzzle and facial structure can cause the airways to be compressed, making it harder for the dog to breathe properly. Some of the common symptoms of brachycephalic airway syndrome in boxer dogs include snoring, wheezing, coughing, and difficulty exercising. These symptoms can vary in severity, with some dogs experiencing mild breathing problems while others may have more severe respiratory distress. Treatment options for brachycephalic airway syndrome may include lifestyle modifications, such as weight management and avoiding strenuous exercise. In some cases, surgical intervention may be necessary to widen the airways and improve breathing. It is important for boxer owners to work closely with their veterinarian to develop a treatment plan that best suits their dog's individual needs.